Good morning, everybody. I'm Louisa. I'm not sure if many of you know me, but I'm the Wellington Health and Wellness Facilitator. And I apologize for my voice this morning. I've got a cold and a cough. Luckily, I'm not in the same room as anyone else, so we should keep these germs contained in Wellington. This morning, we're going to talk about pain. So let's start. Well, I say this, okay. So we are going to be talking about pain and understanding a little bit more about chronic pain. So chronic pain, oh, do you want me to do that? Oh, you're good. You know, I am wondering if I've actually got the right screen for you guys. Let me just check quickly. I think it should be okay. Let's just roll with this one. I think I changed a few things, but it's okay. We can just go with it. So yeah, so this morning I'm going to talk about pain and understanding a little more about chronic pain and the brain systems involved in pain processing. So we will look at common pain management techniques as well. And we often get a lot of questions around pain. So I've kind of based the presentation on some of the common stuff that I get asked. But if we have any more questions or anyone has any questions during the presentation, please let me know. And we can take a little break and answer some. So what is pain? What is the purpose of pain? So as we know, pain is vital for our nervous system and it warns our bodies of potential or actual injury. Pain is also a sensory and emotional experience, and it can be affected by psychological factors as well as past experiences, as well as any beliefs about pain itself and the fear and anxiety around pain. So the actual definition around pain, which I didn't know actually, it's changed recently. And the original definition described pain as an unpleasant sensory and emotional experience associated with actual or potential tissue damage, or described in terms of the damage. The new definition describes the pain as a distressful experience associated with actual or potential tissue damage with sensory, emotional, cognitive, and social components, which makes absolute sense that they've added that. Pain is a somatic experience which reflects on a person's apprehension of the threat to their body. But we now understand that a person doesn't actually need to experience the somatic damage or the damage to the body itself, let's say, to experience the physical pain. But the thought that you are in danger will in itself elicit an experience of pain. Sorry. Chronic pain is described as pain that lasts longer than 3 months. And it is also referred to as persistent or long-term pain, pain that doesn't go away, basically. So when looking at chronic medically unexplained pain, it is thought to be caused by changes that take place in the brain and the nervous system. This can happen after injury or after another condition that takes place even after the damage has healed. So it's like your brain remembers. These brain changes often serve as a purpose for mediating the aftermath of the tissue damage or any kind of damage that has been caused, because it provides signals to protect the area or limit the movement. So if you break a leg, your body's going to tell you, your leg's going to tell you, it really hurts, you need to slow down. Chronic pain then appears when those signals continue to fire, even though the injury may have healed. So when the pain becomes chronic, it is increasingly associated with activity in the affective and motivational systems linked to anxiety and fear, also the perceived threat. And it creates a protective function, basically. Chronic pain is like a car alarm that is activated, but there's no threat to the car, for example. And this is my brain diagram. I hope you can see it. I've added some color. Oh, I'm not very good at drawing, but I've tried my best. But we're going to look at the main areas of the brain that are involved in pain, or what we like to call the pain circle. And these include the thalamus, the somatosensory cortex, the ACC, the amygdala, the hippocampus, and the prefrontal cortex. And we will look at the amygdala in particular, because the amygdala and the hippocampus in conjunction actually mediate any anxiety or fear around pain, as well as the pain memories. It is the prefrontal and frontal cortex as well that is involved in mediating pain. And this can actually bring the attention to any cognitive aspects of pain, including the anticipation of pain. So the amygdala is actually really, really important because everything gets coordinated there. So when you're in pain, your anxiety is going to be high and your mood might be low, and you would be thinking of what we like to call the monkey brain. This is why people tend to make more intuitive mistakes when they're in pain. And this part of the brain really actually benefits from mind-body therapies. So things like mindfulness and meditation, they actually work at an amygdala level, and it changes the amygdala. The hippocampus is another area which is really, really important, and it's responsible for storing pain memories. So these memories are archived when we sleep. So new memories become old memories when we sleep. This really highlights the importance of good restorative sleep, as it's something that is really common for people with fibromyalgia and ME/CFS that experience pain, is that a person who struggles with pain will also struggle sleeping. And it's this disturbance of sleep that can often create disturbance of the archiving of the memories. This can also impact your memory retrieval. People tend to lose focus and experience changes in cognition. So when we think about the neuroplasticity of the brain, these repeated activations of this pain circuit can actually lead to pain memories itself. And the pain memory can be best described as a learned pattern of the brain activity that recreates that experience of pain in the absence of an input. So in the absence of getting hurt, for example. This memory may have started due to physical injury, but it can be maintained by various abnormalities of the nervous system, including increased cortisol. So all of these changes in the brain, which is really, I mean, this is just a little snippet of it because the brain is just an amazing organ. And all of these changes actually gives us understanding of how the profound effect that pain has on people. But what I want you all to remember is that the brain is an organ with the ability to transform. So neuroscience kind of has raised the possibility of developing new treatments and refining existing ones. For example, we know a lot more about mindfulness and meditation now than we did before, and the importance of engaging in those therapies for pain control. Now we're going to look at pain and mirror neurons. This is really, really interesting as well. And I hope you like my diagram of the little monkeys. I just really like them. That's why I added them. But it's really important to consider the role that these mirror neurons play in pain perception, because what we see is often projected onto our brains. So for example, I don't know about you, but when I'm watching a horror film, you get scared. And when you're watching a sad film, you feel the sadness, even though it's not happening to you. So a particular stimulus does not need to be physically happening or physically felt, but the projection of the stimulus onto the brain is enough to feel the physical pain. So this can bring up a lot of emotions that are embedded with the pain processing signals. And this is why sometimes the thought of disturbing trauma, for example, whether it's happening in the past or in the future, or something that may possibly that is going to happen in the present, can still worsen the feeling of pain, as these mirror neurons have formed a network with the pain neurons and can cause an overlapping firing, which again can bring on pain. This is why often people say, oh, I wasn't doing anything and the pain just suddenly got worse. Because in some level, this is exactly what is happening in the brain. The presence of the thought that might even be unconscious of something painful can just bring back the experience of pain. So when we're considering pain, it isn't clear as to people with chronic pain conditions such as fibromyalgia and ME/CFS experience pain. But in general, it is considered to be our brains reacting to signals coming from the nervous system. So most people with pain also experience muscle tightness and knots and headaches and painful joints. And we can sometimes get locked into chronic pain cycles, which can be really, really hard to experience relief from pain. And it can in turn make us feel more physical pain and emotional pain, and we can just get locked into or stuck into these cycles. So stepping out of the cycle is actually really, really important. And this involves kind of recognizing, assessing, and managing. So when we look at the management, we want to be able to recognize, we want to recognize where the pain is, how sore is the area, what does it feel like, how long has it lasted, and is it affecting any other activities that I'm doing? So is it affecting going to work, hanging with your friends, being with your family? We also want to be able to assess the pain. So it's really important to assess what type of pain it is, because often when we have chronic pain conditions such as fibromyalgia, it's important to be assertive, because the symptomology can sometimes be lumped into the umbrella of, say, fibromyalgia, but this might not always be the case. So if the pain feels differently, it's really important to go back to your GP and find out more different, a different type of diagnosis or support that you might get. It's also useful to use the diagnostic criteria of, say, fibromyalgia or ME/CFS to kind of base yourself from that. And when we look at management, I always feel like it's important that we understand what we are experiencing. So the more you learn about pain, the more you can understand where it comes from. Pacing is a really, really good tool, because a frequent cause of pain is overdoing or having an activity level that is beyond a person's limits. So pacing actually offers a way to bring stability and control by keeping the activity level within the limits imposed by the illness. So pacing can involve a variety of strategies. It includes reducing the overall activity level. You can delegate, alternating activities and rest, having a short activity period, switching between high and low intensity tasks, using the best hours of the day for the most kind of demanding activities, staying within your limits for mental and social activity, and keeping records to see between the activity and the symptoms that you're experiencing. Like I always say to my clients, and it's the thing that I always say, if you are going to pace, make sure that you do things that bring you joy as well, because things that bring you joy bring you health. So often we see the piles of dishes and you're like, oh, I don't really want to do this. But if they can wait and you can save your energy or your time of the day where it's good to connect with people or do something that is going to bring you joy, that's really, really important too. We also look at restorative movement. So restorative movement is one of the most commonly prescribed treatments for fibromyalgia, and it can be really helpful for ME/CFS as well. So you can work with a physiotherapist as well. They are really, really good for making a plan around restorative movement. But a good program done regularly can actually help relieve stiffness as well. And it can just help you move your body. You don't need to go running or anything like that. Of course, just save your energy, but just things that will bring your body and that will actually help as well with a lot of the pain. We also need to look at the importance of sleep. Let's talk about sleep management as a tool for pain. So the relationship between sleep and chronic pain is complicated because we don't understand the cause and effect, but there are things that we do know. So the presence of chronic pain in people with fibromyalgia, for example, makes falling asleep and staying asleep really difficult. So sleep deprivation can make us more sensitive to pain, and there's research that shows that it lowers our pain thresholds. So improving sleep should actually be at the core of any pain treatment management. If you are struggling to sleep due to pain, here are some strategies that might help improve your sleep. So emphasizing on your rest is really important. Make sure that sleep is your top priority, setting a schedule that allows plenty of rest, creating a sleep environment that is relaxing and quiet and conducive to sleep. Like I said before, moving your body during the day, gentle stretching and gentle moving will facilitate sleep as well. Using relaxation techniques such as meditation, massage, mind-body exercises. They're not just powerful sleeping tools, but they're also powerful brain management tools. powerful pain management tools for your brain. So a study found that people who did Tai Chi for 3 months regularly, they experienced significantly less pain, and the sleep had really improved as well. Avoiding alcohol, tobacco, and caffeine will also increase your quality of sleep. So these substances might actually make you feel better momentarily. You know, often people might have a drink and they might fall asleep, but they actually disrupt sleep and increases the stress levels in your body. So when you're in pain already and your body's having to cope with enough stress, it's really important not to subject your body to extra chemical stimulants and depressants. Research also suggests that the way that we breathe makes a huge influence in the autonomic and pain processing. So deep breathing exercises for relaxation have been found to be an essential feature in the modulation of sympathetic arousal and pain perception. It is recommended to follow simple breathing exercises. We actually have our lovely Annabelle, who does awesome breathing exercises on Facebook. She's going to share them on our website as well. But it just basically find a comfortable place to sit or lie down, place one hand on your stomach and one on your chest, and really take some deep breaths and notice how it feels. And breathe deeply. You should be able to feel your hand on your stomach and then your other hand rising as your lungs fill. You want to notice the air entering your nose and your mouth, and imagine the air going through your nose and your mouth out again. This can really make a difference in your body. And it's important to take a moment to notice how the body's feeling. And if it's working, and you can tweak it and do different you can imagine stuff as well as you're relaxing. Yeah. Other management tools that we can use, like I said, one of the most powerful management tools that we have available is actually mindfulness and meditation. So we've got all this research using neuroimaging and randomized control studies that confirm that mindfulness and meditation reliably reduce experimentally induced clinical pain. So these are people that have gone in for studies, and they go in and they get poked and prodded so they can feel the pain. And yeah, in this kind of clinical settings, they have found that it really does reduce clinical pain, because it engages multiple unique mechanisms that are different from placebo. And this can differ depending on the levels of mindfulness and meditation that you reach. Mindfulness and meditation also work at a brain level. So like I said before, actively changing your amygdala. And these forms of therapies are really useful, and they, most of them are free unless you go on a course. Like I said, here in CCIS, we have our lovely Annabelle and Phil, who are experts on this. So do take advantage. I have definitely learned a lot from them in the last year. Other forms of therapies, such as acupuncture and TENS machine, as well as massage, are really, really useful too. Pardon me. Distraction and also engaging in new experiences are also great tools to consider. So often what I say to my the members that I speak to on the phone is sometimes just going outside and sitting in nature as well, and just being able to focus on trees or different stuff around you, that it's going to take your mind away from the pain, even if just momentarily. Sometimes we can't be completely free from pain, but it's about reducing the experience. When we're looking at psychological therapies as well, one common one is cognitive behavioral therapy. So how it works is that it helps change the way that people view their pain by changing their thoughts and emotions and behaviors related to pain. Another one that has recently had a lot of evidence to support it is the EMDR type of therapy, which stands for eye movement desensitization reprocessing. And this type of therapy can help process painful traumatic memories. It is also important to consider social support, as chronic pain can affect a person's social life And it's really important for our health to continue to have connections with friends, family, and support groups. So social support and mutual understanding is an effective way of coping with pain. So hanging out with people who understand what you're going through. So going to social meetings with, people who are going through similar experiences. As research has found that meeting with others who are going through similar experiences enables people to develop greater agency from the shared sense of helping. I always go to our social gatherings here in Wellington, and I don't think there's been a time where I haven't actually learned something new. Every time I think I've heard it all, ways of coping and things that we can do to support people, and then I find some something new. So developing that sense of agency from sharing with other people who are going through similar experiences is actually really important. So the greater the social support, the greater the lower levels of pain intensity, basically. So another thing that I wanted to touch on was the CBD and THC and which is better for pain relief. I wanted to touch on this because we get a lot of questions around it. And I'm not an expert, but I've done a little bit of research on it because it's actually really, really interesting. So we know that both THC and CBD work to fight pain in their own unique ways within the human body. So they are cannabinoids, and most people are recommended to use a 1-to-1 ratio to start with, or what the experts call a whole plant medicine. So often the ratios may have to be tweaked depending on the pain and the person. So sometimes, the THC will have to be higher and the CBD lower, or vice versa. Using this approach of having the whole plant medicine actually prevents patients, it minimizes the unwanted side effects, and those unwanted side effects can sometimes be that feeling of highness. So it depends on the ratios, and often the CBD clinics can get this right. Cannabis affects people differently, and there are different factors to consider, such as gender and age and biochemistry, tolerance, genetics, health, and the way that obviously it is consumed. So what we do know is that THC has been scientifically proven to be a powerful anti-inflammatory as well as an analgesic or painkiller. THC is widely used by patients because it's very good at treating some kinds of pain, for example, fibromyalgia pain, muscle spasms, cancer pain, and many more. Whilst high CBD strains, on the other hand, can be used to treat pain such as migraine and nerve pain and more. So the combination of the two of them together, it's like the whole package, basically. What we do need to be aware is that THC has a biphasic effect. So it means if you take a really high dose, it can actually make the pain worse. And this is the reason for microdosing. And often this is the reason why it's best to go to, the CBD clinics, because they can get the ratios right, and they can play around with the strength of the medicine. So I wanted to talk as well. Anyone have any questions? Sorry, I'll stop here just in case anyone have any questions so far. We will have a time to ask questions later on as well. I just thought I'd ask just in case. No. I also wanted to touch on opioids and other medications for the treatment of pain, because pain medication works in different levels. And although there is a role for pain medication, it has to be the right thing for the right person. And there are often shortcomings of pharmacological pain therapies, such as the recent evidence that shows that opioid-based therapies actually provide really little benefit, and can actually exacerbate chronic pain, so it can make it worse. As we know, the long-term use of opioids has adverse effects on our health, and it can further compromise things like our respiratory system, the central nervous system, cardiovascular system, gastrointestinal system, immune and endocrine system, all the systems basically. And this is why GPs are often cautious about prescribing opioids. And often there needs to be a plan about transitioning away from them if you are on them. So they can only be used for a short time, and then they like to kind of try something else. So when looking at what works for patients, I was having a look at some meta-analysis and systematic reviews, and so it's basically looking at research combined. And when it comes to medication, the membrane stabilizers such as gabapentin have been reported to significantly improve pain in people that obviously took part in the studies that I was reading. It also reduces the sleep interference, and it gives health-related quality of life and improves your mood. Often we see is that these medications are mixed with other medications. So some people might be on amitriptyline, for example, as well. And they are slow working medications. So we have to keep this in mind that often it takes a few weeks for this medication to kick in, and it all depends on the way that they're absorbed in the body. And it's, yeah, and the doses have to be tweaked in between. So we just have to be a little patient on how quickly they work. Another one that is really important to consider is low dose naltrexone and naltrexone. I never pronounce it properly. Let's call it LDN for short, which is an opioid antagonist. It has an analgesic effect, and it has anti-inflammatory effects as well. This decreases the severity of the symptoms in a wide range of chronic pain conditions, so it's widely used for people with fibromyalgia. I also wanted to go back to calming our response. So learning how to manage and cope with the pain in our brains. The pain we experience in our brains is really important and can take time, and it's quite hard. It's not a walk in the park, but over time, you do develop a deeper understanding and better tools to reduce the symptoms. So even though the pain is chronic, it is still real. Your brain is making itself feel sore, so the brain is feeling the pain. We can try and desensitize our brain to the confusing signals and reduce the experience of pain. So like I said, I hate to go on like a broken record, but mindfulness and meditation is one of those things that are really, really useful to desensitize our brain. As mindfulness is defined by actively making new distinctions about present situations, experiences, and related information. So instead of acting on autopilot, being mindful means that viewing incoming information as new and context dependent rather than relying on categories that we have created in the past. Studies that looked at the mechanisms by which mindfulness affects pain often rely on touch and tactile testing of pain perception. And the findings actually revealed that mindfulness increased both pain threshold and pain tolerance thresholds, as well as reducing the pain intensity. So these type of findings really, really point out the benefits of mindfulness and reducing the sensitivity and reactivity to harmful or unpleasant stimuli. So this is me. If anybody has any questions, and like I said, this is kind of just touching in the surface, but we have a lot more information that we can share with you as well as health and wellness facilitators. And just, yeah, if anyone has any questions.